Hi, this is Dr. Peter Osborne with Gluten-Free Society on the phone with Dr. Thomas O'Brien. Dr. O'Brien is a nationally recognized lecturer on the topic of gluten sensitivity and the gluten spectrum of disorders. He is adjunct faculty for the Institute of Functional Medicine as well as the National University of Health Sciences. He's on the Scientific Advisory Committee for the International and American Association of Clinical Nutritionists, and he's been going across the country lecturing on the topic of gluten sensitivity and how better to identify it and how better to help treat people. Dr. O'Brien, thanks for joining me today. How are you?
I'm well, thank you. Good morning, Peter.
Why don't you tell us a little bit more about yourself?
Okay. Well, what got me interested in the field of gluten sensitivity and celiac disease was my friend David Perlmutter, a neurologist in Naples, who is a very smart man and on the lecture circuit teaching physicians. And back in 2001, he was giving a presentation on brain function, and he showed a study of 10 patients that had severe migraines and gait ataxia, meaning it was awkward for them to walk properly. And these patients had been on workman's compensation for an average of 8 years. And when he said that, it just got me to think about what's it like in the family of a home where dad has migraines so bad he can't work and hasn't been able to work on average for 8 years. They've gone through their life savings and they've gone maybe their retirement funds, and I made all this up in my mind, but I'm just imagining where, shh, dad's got a headache, shh. What was it like for the children in that home? And that really caught my attention. And as he spoke to the study, he said that the doctor they went to see, a very famous neurologist named Hajivasulu, put them all on a gluten-free diet, and 7 out of 10, their headaches went away. They never had a headache again. 2 out of 10 had partial relief, and the 10th one refused the diet. So, and then he showed the MRIs of those patients, and they all had lesions in the brain. So I ordered that study, and it was in the journal Neurology, and I read that study, and then I was so captivated by it, I ordered the references in the back of the study that author referred to and read those, and that just got me off and going. And I've been studying this now since 2001 and been on the lecture circuit since 2004, speaking to the general public and to physician groups and healthcare practitioners around the world.
Wow, what a interesting way to get into it.
It really was.
So, we were talking before, and you mentioned that there's a new lab coming out, and I wanted to introduce that to the celiac world, to the gluten-free world through you, because I think it would have a lot of value for patients around the world. Can you tell us a little bit about Cyrex Labs and what they've got coming out?
Yes, I can. Thank you. And it's very thrilling for me that I've been looking forward to this for 2 years, and I've been speaking about it in my lectures for 2 years. The tests are coming. The tests are coming. If I can back up a little bit, as I speak to general public and to patients on this, I talk about the intestines are a tube that goes through your abdomen, and 20 to 25 feet of this tube, and the inside of the tube is lined with shag carpeting. And this shag over here is where calcium's absorbed, and this shag vitamin B, and this shag over here magnesium, and this shag proteins, and all the shags absorb different nutrients. And that's how we get the vitamins and minerals out of our food into the bloodstream. What happens with celiac disease, which is the allergy to wheat and associated grains that affects the intestines, what happens to celiac disease is that the shags wear down. And when the shags wear down, you get Berber. Instead of shag carpeting, you got Berber. And there's no shags. If you don't have shags, you don't absorb calcium. If you don't absorb calcium, you get osteoporosis. It's not rocket science as to why the Annals of Internal Medicine in 2006 said we have no hesitancy saying that every osteoporotic patient needs to be tested for celiac disease, as celiac disease could be the cause of their osteoporosis. And as you know, osteoporosis is an epidemic in our culture. The baby boomers are coming into their 50s and 60s, and osteoporosis is rampant right now. And part of the reason for it, and one of the main contributors via the Annals of Internal Medicine, is this gluten sensitivity. So if your shags wear down, you don't absorb calcium and vitamin D or other nutrients, or you don't absorb B complex, and you're at more risk for infertility or for miscarriages, and all the papers that talk about celiac disease and reproductive disorders. It may be malabsorption of nutrients that contributed to that. So your shags wear down. Well, many patients and many doctors validate this, is that they get a blood test for celiac disease and it comes back negative. And yet the patient knows that when they go gluten-free, they feel better. But the doctor says, no, your blood test is negative, it's okay to eat wheat. And they say it's all in your head or something, and patients are confused, and it's difficult at first to give up wheat. So they're left in a state of confusion, and maybe they'll cut it down a little bit or something. They're getting not comprehensive information. The reason that the blood tests come back negative sometimes, if you have total villus atrophy, if your shags are worn down completely, total villus atrophy, the blood tests, which are out there now, are sensitive and specific 96 to 98% of the time. That means they're right on the money. More than 9 out of 10 times, they're really good blood tests to do. But if you don't have total villus atrophy, if your shags are only partially worn down, or if they haven't started to wear down yet and you've just got inflammation in the gut, which is the most dangerous one, and I hope we get to that, mortality from inflammation. If you just have the inflammation or just partial villus atrophy, the blood test sensitivity and specificity goes down to 27 to 30%, which means the blood test will be wrong or could be wrong 7 out of 10 times. We thought the blood test identifies the disease. It does not. The blood test identifies the end-stage damage of the disease. So the blood tests are right on the money at the end-stage damage. But if they don't have end-stage damage, total villus atrophy, the blood test can be wrong up to 7 out of 10 times. I call that the conundrum of gluten sensitivity. You test for it, it's negative, you go gluten-free, you feel better, what do? It's not that the tests are, it's not that the patient's wrong, they know what they feel, it's that the test was the wrong test to do. And it's been a very useful test. It's helped us identify many more patients. However, in clinical practice, we often find that it's not consistent with the clinical results. Thus, we need a more sensitive test.